A Quebec union rep says he was hurt by everything he saw and heard as COVID-19 ripped through long-term care homes during the first wave of the pandemic. He delivered blistering testimony at an inquest that's looking at Quebec's worst-hit residences. And Natalie Collada is looking at some of the testimony that we have heard so far. Natalie, good morning.
Good morning, Heather. Well, what we are looking at this morning is the testimony examining and investigating what happened at 6 public long-term care facilities and 1 private long-term care residence, along with 1 death per each establishment. That's how it's set up. So the accounts that we have heard this week, including from union rep that you mentioned in your introduction there, Heather, Gilles Tremblay, talked about the impact of what he saw, that he saw things that were so difficult that he then had to retire after the first wave. He spoke about kitchen staff, particularly at 1 facility, the St. Dorothy facility. That's the long-term care facility that's the hardest hit. You see it on your screen there, with some of the highest death tolls in Quebec's long-term care system, 102 of its residents dying during the pandemic. He talked about how kitchen staff asked for those N95 masks, didn't receive it. They didn't have that proper PPE, and that the union rep said soon after they all fell rather ill. He described what happened at that particular facility as, quote, ageicide. He also heard the testimony also took part and heard from 1 patient attendant who testified yesterday, who said simply that them and 1 other coworker were responsible for 34 patients alone. An occupational therapist described what they saw, how they had to work different floors every day, and as a result they knew so little about the patients that when they walked into the room, they weren't sure if they were walking into a room where someone was alive or someone had died. Now, the coroner, so affected by that particular point, he said, quote, you were sent to war without weapons. That's how the coroner described what that situation was in that particular care home. And this occupational therapist was one of the last people to see an individual alive. That's 94-year-old Anne-Josée Marquette. She is the person whose death is being investigated. She appeared in good shape. They administered a cocktail of a sedative as well as painkillers, and then she died. So we heard from several witnesses last week that talked about this being a regular practice and some of the concern about that as well, Heather.
And family members of Anne-Josée Marquette have testified. What did they specifically say, Natalie?
Well, the son of Marquette spoke to the inquest, talking about his outrage. He sobbed through his testimony. He was very upset. Have a listen to how he described it.
They decided to put her on morphine, which in a matter of hours ended her life. Nothing was done. The doctor wasn't there. He refused to enter the CHSLD, and she received no medical assistance whatsoever. Her and a whole lot of other people. They were condemned to death. To me, it was criminal negligence.
Now, as you can see there, strong emotions coming from him. It is important to mention the inquiry here is not, the aim of it is not to determine guilt, but to come up with recommendations to prevent similar tragedies. And we, of course, also heard from Quebec's long-term care minister, who says the government is cooperating with the investigation. Heather?
Natalie, thank you very much.